Welcome to Health Stealth Radio, where we move away from the mundane to gather insights from the shadows of enterprise and patient cybersecurity. Yes, we surely believe that traditional themes like endpoint software and zero trust are critical, but given massive advances in AI, remote and wearable device hacking, and data hostage negotiators, there's a much darker side to cybersecurity, and not everyone is quite willing to talk about it in public. Health Stealth Radio will thrive on these topics and encourage fireside spats to debate them. Here's your host, Frank Cutitta.
Good afternoon, good morning, wherever you are. I'm Frank Cutitta with Digital Health Insights from Chime. I'm always thrilled to have one of my dear friends and guests on my show, Carter Groome. I'll let him do a brief introduction of himself, what he does a day in the life of Carter, and then we'll move on. We're looking to keep this as a natural conversation and not your typical Q&A. And great question, Frank.
That's why I love talking to you, Frank.
Just going to move on. And so a brief introduction about First Health.
Yeah, great to see you, Frank. Thanks for having me. Great to be here at Vive in Los Angeles. I'm Carter, CEO of First Health Advisory. We do security work, privacy work, risk management work, and AI risk in the healthcare sector. And it's just been a really busy time for us. So it's just really good to be here and talk to you.
Well, I mean, we have no shortage of themes coming out of this conference already. We've only been in 6 hours now. And it does a new things because everyone is embracing AI, yet at the same time running away from it, saying, I'm tired of AI. So I'm just curious, in the short time that you've been here and you're on the road doing these things all the time, what would you say are some of the first of all, the buzzwords that we'll keep, but some of the ones that you just keep on hearing and more, not that again.
Right. I mean, well, first of all, I feel like you'd be arrested if you didn't talk about AI at this event, right? And I look at it, AI from two different buckets, essentially, Frank. One is the adoption of AI within the healthcare systems and everything that we've talked about in terms of how it's going to make organizations more efficient, how we're going to replace resources, what are we going to do with AI? And then there's AI from a security perspective. What are health systems doing to bring in security tools that are going to react more quickly to the adversarial use of AI? So those are kind of two different flavors that we look at. And then oftentimes it merges, right? You need to understand the risk that you're bringing into organizations by adopting AI, and then ultimately how you protect against that. What are the governance? What are the controls that you need to put in place to make that less risky?
You characterize the co-evolution of cybersecurity AI with general AI. Is cybersecurity further along on the train, or is it still in that same infancy movement? The regular AI, and we say it's great for mundane and rudimentary type tasks. And cybersecurity is totally different. These aren't mundane tasks. So is the evolutionary pattern different for cybersecurity?
I think so. It makes me think a little bit about how we rolled out technology at the beginning of the pandemic, right? We just had to get something out to make our organizations function, right? Telemedicine, get laptops in the hands of people so they can work remotely. And security then became secondary. And this is what I've seen a little bit of here and over the last year and a half with AI. We are almost pressured to adopt AI for all of the use cases that we've talked about and all of the promise that we've talked about, but we've never really addressed the peril side of it. Now, I think 2026 is going to be the year that we say, wow, we've pushed all this technology out here. Is it safe? Is it responsible? Is it ethical? And what are we going to do to make sure that our patients that we're trying to protect and their information is protected through the use of AI?
We're at that point where it's I don't want to say governing because that's the other word that's used. It has to be used system, but it's got different definitions. So we're in how we control the AI. That's part of it. And one of the buzzwords I've heard for the last few months in doing focus groups and dinners and things like that is this whole shadow AI movement, which for many of us that have been around for a long time, I used to have a shadow IT group in my marketing department because I didn't like the way the guys, but this is different. This is different kind of shadow. I mean, it's people. And so how are we controlling people that have become totally infatuated like this during the old days where we went on to Google and we were looking for restaurants. Next thing we're fly fishing in Argentina. How do you look at people going into Gen AI in healthcare settings at the proletariat level?
Yeah.
Managers of security handling that.
Yeah. I mean, I think shadow AI is a huge issue, and I'm glad that we're talking about it here at this event. There are similarities to traditional, shadow IT in a way that you don't understand where it's being used, how it's being used, and for what purpose per se. And when I think about good security and privacy and risk management of AI, you need to start by understanding where it's being used. And a lot of organizations that we go into and assess their risk, they think, oh, I've got 10, 12, 15 applications that I know are using our data in a generative fashion, right? Or we're training models, et cetera. And when we then go in and assess actually where the organization is using AI, it is on average about 10x of what that organization thought. And that's what I view as shadow AI. It's something that the organization didn't even know, a platform and application they didn't even know was using AI in their data to feed their models, right? And that's when we talk about governance, you have to absolutely start right there with understanding an inventory of where AI is being used. Otherwise, the governance that you put in place, that's really important, is not going to have any effect if you don't even know what to govern. Right? We talk about these guardrails, Frank. We talk about all these controls and policies, and there's a bunch of different disciplines that are involved in AI governance, right? It's not just IT and security and clinicians and ethicians. And I mean, it is the entire organization that plays a role in that. But if you don't understand where in the organization AI is being leveraged, then there's no way you're going to govern it.
So if you're brought in on an engagement for a client, saying what you just said, what's the first thing you do? What's like step number one, the beginner's guide to bringing in First Health and working with controlling?
Yeah.
At least identifying.
Right. I mean, it truly begins. Yes, there are other things in reviewing policy, but truly understanding that inventory and getting what we call visibility of AI. And if you have that visibility, or some may say observability of how it's operating, then you can start to apply the controls and those guardrails that the governance that you have in place are intended to do. And the challenge now that we're seeing with governance, right, is a lot of organizations are starting to build that they understand they need to put governance around AI, but it is, if you have a governance committee meeting, or I don't even know, a compliance meeting that would talk about AI and what's coming in the front door, but if that happens once a month, what happens in between those meetings, right? Because the pace at which we are adopting AI is moving so quickly that traditional IT governance that's very similar doesn't apply with the pace that AI is moving. So you need to have those controls somehow monitor and be in place for decisions that are being made in between those governance meetings. I mean, that's a challenge.
Huge.
Yeah.
It's sort of interesting when you listen to some of the sessions just in the short period we're on today. People were talking about that we're installing 30 new platforms, but we're not looking at retiring other ones. So there's this sprawl of, do you find that the part of this in terms of the work you're doing I wrote a piece, or we wrote a piece on the retirement guide for aging technology. So do you find that there's that in just letting stuff go?
Oh, yeah. We absolutely see that in cyber, right? And part of the challenge of AI is we're adopting AI to think we're fixing something that is already broken, right? And so that's something of a trend that we're seeing, right? And I also see organizations adopting AI for the sake of adopting AI, right? You've heard it, right? We have a solution to a problem and we're not fixing a problem, right? But from a security perspective, when you're introducing AI into the organization, your attack surface widens exponentially, right? Because now you've got all these different individuals that are adding information into that could leak out, right? We see a lot of leakage in terms of where those systems, where those large language models and agents are connected. And that's when you really start to get involved in third party or supply chain risk. So that's where AI really increases the attack surface and what I really worry about as a security practitioner.
Interesting. Where is that on the cybersecurity menu? I mean, is it still, we're trying to regulate it? I mean, is there good stuff out there?
Gosh, yeah. I mean, now you're getting into the really meaty stuff, Frank, right? Because we've seen just this massive uptick in vishing, like synthetic voice attacks that sound, Frank, you're calling into the help desk, and you're saying, hey, I'm traveling, I've lost my phone, and I can't remember my password. I need you to reset my password, and I need you to re-engage a new phone too at the same time. You sound so credible. And then you want to do some video checks. You want to check with the manager to make sure that it's legitimate that you were traveling. There's all these kind of controls, but you still need some other controls out there to reduce the risk. So a lot of what we talked about is not only multi-factor, but having another authentication key, another factor to just getting a number on your phone through SMS or something, right? So that's one way of really defending against it, is having a key. But that's inconvenient for thousands of employees within the healthcare system. So what else do? You can do certain identification of face and then have an escalation point if you've got two things you want to do. You want to change your password and re-authenticate a phone. Boy, that needs to set off a bunch of alerts within the healthcare system. And then when you say, okay, we're going to do this, I'm seeing health systems now say, okay, we're going to allow that to happen, but we're going to track activity of that user at a rate that we wouldn't normally track somebody in the organization to see if all of a sudden that became a bad actor, right? But that's just one example. We're seeing the speed with which the adversary use AI to get into systems increase tremendously. So that's a concern as well.
Going along with that, everybody wants these protections, but we're always balancing the user experience and the intrusion factor. How many things am I going to have to do? Are we mitigating that in terms of the user experience? Not saying, oh my God, do I have to get 3 emails until text?
Yeah, gosh. For so many years, Frank, and we still do, right? We talk about security and IT being an enabler of the business. And the term, that Carl West actually, back from Intermountain days would coin was frictionless security. We don't want to get in the way of business. The challenge is you are then accepting certain risks when you say we want to make the user experience frictionless, right? And that creates, as I said, risk. And organizations, I'm starting to see them move towards, we need to make it a little bit more intrusive. We need to make it a little bit of a challenge, because the adversary understands that ease and they take advantage of that idea that we want to make it frictionless. I think what's going to start happening is we hear all these stories of these high profile doctors or big money earning departments saying, I don't want to do that. This is ridiculous. I've got a patient on the table, or I got to do this. And I've advocated for, hey, we need to add a little bit more friction. I mean, we're talking about the capital risk of an organization. We talk about patient safety too, and I think there's mixed feelings on patient safety. It's we're also talking about capital risk to the organization, and so it's my belief we're going to have to accept some of these things to be less risky in the healthcare field.
So I'm sort of a poser as a journalist. I'm really a global marketing guy by training, but so I take great interest in studying terminology and buzzwords. One of the arguments I've had with, not arguments, great intellectual discussions is with zero trust people saying you got to start. I'm just saying, as a marketing guy, I think people starting to get desensitized to it because it's sort of like Tourette's. It's over.
Yeah.
So post zero trust, what do you envision as being the next generation of zero trust, or even if it just came up with a trendier name that's it's not your grandfather's? Zero trust.
Yeah, I mean, gosh, it's such a great point, because zero trust as a philosophy has a really, really solid foundation, principally in terms of how you reduce risk in an organization. I don't think the early thought leaders on zero trust did a great job of explaining what it was to the lay community, right? So, security practitioners kind of understand the concept, but it has just become this buzzword that people think they understand, and there's nothing deeper than that, unfortunately. Now, what I like to think about and what I see kind of happening in going forward is this idea of default deny, right? So that is a little bit more explanatory, right? So within the organization, yes, a lot of organizations still have defense in depth strategies to keep an attacker from coming in. The problem is attackers are getting in at a lot higher rate because they're using credentials of legitimate employees or associates of an organization, right? So I say hackers aren't even hacking anymore. They're just logging in. The problem when you don't use some of those principles of default deny is once somebody's in and they look like a legitimate actor within the organization, they can do anything they want. They have free reign. So all your defense and death strategies go away. Default deny then looks at different identities within the organization, whether it's a person or an AI agent, and says you can or cannot have access to these systems, these applications, this data, etc. And it's checking that within the organization. And that is really getting to the root of what I call the left of something bad happening. And the further left you can get to something bad happening before you have to apply any other controls is the most effective way, in my view, to reduce risk, right? We talk about resilience and business continuity and all these other things that you do if you get attacked, right? That's all to the right. And you need to detect that stuff. You need to detect intrusions and bad actors getting into your system. But if you can deny it from the beginning with a multi-factor, right? Basically, you can't break into somebody else's phone and impersonate them and get in between MFA or the default deny strategies. That's really where you can make progress in a program. So, yeah.
Glad it's moving along, at least to a different word.
Yeah, I think that's more common, right? You're going to hear that a lot.
I hear the zero trust stuff all the time, and it's just everybody says, what's going to happen next?
Well, and the other thing is, Frank, and zero trust or default deny, that is the first principle of cyber. I mean, that is foundational in a way. The challenge is it doesn't all apply to the healthcare sector because you don't want to automate every decision, especially when you have a patient hooked up to a machine, right? And that machine gets shut down for one reason or another because of some false positive or some situation, right? So you got to be really careful, especially when you're talking about IoT or medical devices in that situation, right? So it is different from other sectors where it's a lot easier to apply those principles.
Bring up the lay reaction to these terms. You argue that our cybersecurity literacy in enterprise is related to that thing you get once a month saying you have to update your coursework and you go online and half the time you can pay the system. Don't you think that there's along with this evolution of cybersecurity, there needs to be more cybersecurity literacy other than 15-minute
without a doubt,
and custom related to phishing attempts, things like that.
Yeah.
Do people have a palate for? Do lay people? Do they care?
I want to believe so, right? I mean, there's always going to be a faction of any organization that says, I'm just so tired of the awareness and education and the constant messaging around that. But that can never, ever go out of style. That can never not be a strategy within an organization. You've got always new people coming into the organization that you need to train and bring awareness to, right? And that is a major foundational part of any good program.
Is virtual reality coming into this?
Yeah, for sure. Yeah. I mean, so that's helping training on what we were just talking about, deep fake, synthetic voice, like different tactics. So I love the training that looks at it from an adversarial perspective. This is how you're getting tricked. This is how you're getting beat, right? And that training is the most effective because when people say, oh, wow, I heard about this, they start thinking about it and they become part of the security program, even if they're not in IT or security, right? And when you get to that level, and obviously the tone is set at the top, but when you get to that level where there is general awareness within the organization, it has impact. There's no doubt in my mind it has impact.
Deepfake is bad, but the great thing about deepfake is people are fascinated by it, even more so than phishing in a way. So it's taking it onto steroids. And this is something that a layperson can identify with. Because my mother just got one of these calls to suck all the money out of her banking account. So I think those are educational things that people probably could be more interested than basic, don't want to click on this link.
But I think human nature is people want to be helpful. And look, if they're paranoid by nature and they're seeing things and they're saying, I think this is malicious, even if it's not, I'd rather have that than everybody just clicking everything. And it's not just within email, it's on LinkedIn and all these others. So, you've got to think of new ways to train these people to say, hey, every facet of your life now is exposed. And that's going to actually expose the business that you work for as well. So your personal risk is your business risk. They're one and the same. This is what I tell boards and executives all the time, because those are the folks that are most attacked within any organization.
So you posed the term the bad actors, and I'm just curious how the characteristics and the actions of the bad actors are changing compared to when we first talked 2 years ago. You see?
Yeah, look, I mean,
they come from different places.
right. I mean, like, and there's all different categories, right? There's e-crime and nation state. And I mean, but it's still, and I think the latest number that I saw from the CrowdStrike report was about 75% was e-crime. So it's still economically motivated. We're going to come in, we're going to lock up your systems, or we're going to exfiltrate your data, and then we're going to threaten to sell it if you don't pay us X money. And then we might go to the individuals and threaten them if they don't pay us money. And it's just awful. And then you kind of pile in the class action suits. So it's like the third level of extortion in a way, right? And most organizations are paying those class action suits pretty quickly. So it's still economically driven e-crime. Yes, you see some harvesting from nation states and whatnot, but that's still what is the biggest threat out there. And ransomware is the gift that just keeps on giving, right? We thought we were in a little bit of a lull in the fourth quarter and coming into this year, and then we've seen a real big uptick in ransomware in the last couple of weeks, right? So this is just not going away. It's not just targeting the largest organizations that they think are going to pay. It's across the board still. Absolutely. I mean, we just had 2 major ransomware events last week that locked up health systems. It is still happening. So it's 2026. But I would say, coming back to the awareness piece, I'm encouraged, right? 10, 12 years ago when I was getting into this, I mean, education and awareness was everything. And we'd go into every organization and we'd have to just talk to people about what cyber is to begin with, not even just defensive tactics or things that you do to become more resilient. Most of the organizations I go into, there is a broad level of awareness at the executive suite, the board, and I'm encouraged by that. And I think in no small part due to Colonial Pipeline that asked a lot of questions and then changed healthcare, right? So this bubbled up to the executive level. They started asking questions at the board level. And so when I walk into an organization like that, I can tell almost immediately the tone of the organization based on what those executives are talking about.
So I always short on time and everything we do, but I just want to make sure that we talked a little bit about the policy side of this. And how crazy dysfunctional in Washington is right now. I've had, because of the work I do, I've seen some bright spots with hospital home waiver being passed.
Yeah.
Continue the reimbursements on that.
Yeah.
See productive coming out of DC that we talked about the HIPAA stuff.
Oh,
restaurant.
There's, look, we could spend another hour, Frank, just talking about policy movement. I think that 2026 is going to be a big year for all of us to really understand where the administration sits on policy, where 25 was just not a lot of movement at all. It was almost, what can we pull back from a regulatory perspective? But the big things I'm looking at, yeah, of course, TEFCA's out there, hospital at home, telehealth. Those are macro issues within healthcare. From a cyber perspective, we're looking at the HIPAA privacy rule. There's movement on that. And that's a lot of right of access stuff there. So we might see that after years of being in proposed rulemaking. And then there's a lot of chatter about the security rule. There's in the Federal Register, the unified agenda, it says May of 2026. And so there's a lot of chatter out there. This thing's coming. There's no way on the planet that this thing is coming in May, right? I will bet my company on that. And if you go back and look at this video and call me out on it, because I'll eat crow, right? Now, the administration, HHS and OCR and Director Standard, is starting to talk a little bit about the security rule. And they want to. I genuinely believe they want to engage the community, and Healthcare Sector Coordinating Council is a big part of that community, to say, what do we do to make a better rule than what we had at the end of 2024 that was proposed? So I think there's going to be movement on the security rule. I don't think it's going to be in 2026. And I think there's going to be genuine engagement from the community to say, what rules can we put in place that give us a good baseline and an update without being extremely burdensome on the healthcare? I'm watching CIRCIA. I'm watching the security bill that came out of Cassidy's office. That's in markup probably next week. So there's just a lot of movement in healthcare cybersecurity. What we're not seeing, and this is no surprise, we're not seeing any real dollars behind this coming from our policymakers to say, what can we do to invest and improve our overall nation's posture in cybersecurity? So that's something that we're always looking for and advocating for.
One last question, dear to my heart. Doing a lot of work on CISO burnout. So I'm sure people bring you on board is, man, I can't do this all by myself.
Yeah.
Giant behavioral guys, talking to them about that. I've got a CISO psychiatrist getting into a webinar.
Oh, it's so real. I mean, yeah, we talk about clinician burnout, but you can't not talk about CISO and CIO burnout, right? And one of the big debates from the CISO community is, well, I have all this accountability, but I can't actually make the decisions from a budget perspective. I can't set the tone and make, acquisition or purchase decisions, for resources, for technology, et cetera. But I hold all the accountability. And that's still a problem, right? And that leads to burnout, right? Because you feel all the pressure if you have a bad day that you're going to be the one. You're going to be the one that's going to take the hit, right? And it still happens, and we've seen it. Yeah, we've seen it, right? Yeah. But and it takes a certain personality, one, to be able to get into that role. You have to be a resilient person and take on a lot of hits, right? But even then, I think a lot of individuals are saying, I've had enough. I need to move out of this role. I need a little bit more control. And so it is of high concern in our community.
Doctors had pajama time where they went back and had it.
Yeah.
It's not even any luxury pajama time.
There's no equivalent to what the physicians are seeing from ambient technology or other coding advances through AI that we're seeing in the security community. I mean, yeah, we're using AI for certain things like SOC Tier 1, looking at reducing noise and vulnerabilities and stuff, but that doesn't somehow take hours back into my day as a CISO. Yeah, where's our pajama time? I want to know that.
That's a great way to go. Carter, just fantastic having you. I love your energy. And as you mentioned, I could go on another hour about this topic. We'll do that and go on another hour.
Great to see you, Frank. Yeah, thanks for having me.
Right.
Thank you for joining us today in the shadows for this episode of Health Stealth Radio with Frank Cutitta. If you like the program, please be sure to share your comments on our social media sites, or feel free to contact us with suggestions for new and stealthy show themes. We look forward to welcoming you again for our next broadcast. In the meantime, stay safe out there.